Good morning to all my dears. Today we are going to discuss about the clinical examination of cardiovascular system. First of all, let us see which are the prerequisites and position of the doctor to examine the cardiovascular system. First of all, take consent from the patient and you have to explain or communicate your patient to what you are going to do and what may be expected to observe from the patient's status. And after that, try to stand always on the right side of the patient, and the examination hall or examination room should be properly ventilated. As far as possible, proper natural lighting should be there, or otherwise other adequate lighting should be maintained in that room. Head end of the patient should be elevated at 45 degrees and expose the body of your patient up to waist. In examining your patient, if the doctor is a male one and the patient is female, there should be a female attender or nurse to protect the doctor from possibility of accusation of immodesty. So let us try to examine the precordium of our patient. Regarding the examination of precordium, as you know, first of all we have to inspect the precordium about the shape of the chest. Is there any distended veins, and what about the position of trachea? Is there any scar marks or sinuses? Is there any abnormal cardiac impulses and other findings? Regarding the shape of the chest, normally it is elliptical one. That means the anteroposterior diameter of the chest is usually less than that of the transverse direction. That is what we call the elliptical in shape. And next we have to examine about the precordium regarding is there any abnormal precordial bulge or depression, because there may be some pathological conditions that may lead to bulging of the chest or bulging of the precordium, as in pericardial effusion or in aneurysm of aorta, congestive heart disease, mitral stenosis, or right ventricular dilatation. And congenital deformity can also lead to bulging of the precordium or chest, and non-cardiac conditions like bronchogenic carcinoma or orthopedic condition like scoliosis. And at the same time, the depression of precordium or the retraction of precordium can also be seen in some of our patients, and it may be due to congenital issues or compressive pathology and collapse of lung, and there may be deviation of the apex beat can be seen in such condition. Next we have to examine the possibility of any abnormal distended vein over the chest. Usually there may not be any veins can be in chest, and there may be very few very small veins may be present in chest, especially in thin subjects. At the same time, some of our patients may present with some tortuous veins, mostly on the lateral part of the chest. That means if there are any superior or inferior vena cava obstruction, or in conditions like portal hypertension or aneurysm of aorta, or any growth which may compress the major blood vessels. In such condition, you can see some abnormal vessels or veins in chest of your patient. Next, we have to inspect about the abnormal pulsation in veins. If there are any pulsation, as in case of increased jugular venous pressure or jugular venous pulsation, that means the pulsation in neck may be due to aortic regurgitation or aneurysm of aorta, or in patient with a systemic hypertension or some congenital defects like coarctation of aorta, or in conditions like atrial septal defect or in ventricular septal defect, or huge right ventricular hypertrophy or left atrial dilatations. In such condition, there is a great possibility of pulsation in neck of our patient. If our patient is having severe pulmonary hypertension or right heart failure, that may also leads to abnormal pulsation in neck of your patient. Regarding the epigastric region, you can see some abnormal pulsation, especially in thin personality or in nervous individuals. Pathological conditions like right ventricular hypertrophy, aneurysm of abdominal aorta, and patient with a systemic hypertension, the epigastric pulsation may be seen. Usually epigastric and right hypochondrial pulsations are considered to be the hepatic origin. In young and thin chest wall individuals, parasternal pulsation can also be seen, or it may be considered as a normal one. Prominent veins on face usually may be due to superior vena cava obstruction, or may be due to bronchogenic carcinoma or mediastinal tumor or lymphoma. Next, about the position of trachea. While inspecting the position of trachea, you have to look for any mediastinal shift or deviation of the trachea. If there is grossly deviated trachea, inspection itself is enough. Otherwise, we have to palpate the same, and that can be dealt in next part. And to observe the tracheal deviation, it is better to ask the patient to sit and observe the same. Next, we have to examine about, is there any abnormal scar marking over chest. You can see some scars on central area of chest of your patient that indicate, usually that may be due to previous surgical procedure. It may be due to a case of sternotomy, or if there is scar in mammary area, that may be a possibly mitral valvotomy. And if it is below the clavicle of your patient, and if there is bulging also, mostly that may be due to implanted pacemaker. And there may be some sinuses, usually with history of old tuberculosis. Inspection for apical impulse plays great importance in inspection of chest or inspection of precordium, especially regarding the examination of cardiovascular system. As you know, the apical impulse will usually just beneath the left nipple or left fifth intercostal space, just half an inch medial to the midclavicular line. Normally, it is not visible, and the personalities with a obese personality, and if the impulse is just behind the ribs, usually it is not visible. We have to look for pulsation other than in cardiac areas. That means second left or right, or left fifth or left fourth intercostal space. These are the cardiac areas. If so, that may be due to any cardiac pathology. So, by simple inspection of the chest, especially regarding the shape or distended vessels, or regarding the abnormal position of trachea, or the abnormal scar marks or sinuses or abnormal cardiac impulses, etc. give valuable clue regarding the possibility of underlying cardiac pathology. So, as a part of investigation, next we have to look for the palpation of cardiovascular system that can be dealt in next class.